There are things that pelvic floor physical therapists can do to help strengthen the muscles in the pelvic region.
So pelvic floor issues with HEDS, especially frequent urination, what might someone do?
So pelvic floor issues are very, very common among people with HEDS. There's a lot of connective tissue in the pelvis that holds those organs in the proper place. And if the connective tissue is lax, it can really impact the function and the comfort in the pelvic area. If somebody is having a prolapse, urinary bladder prolapse, or prolapse of the uterus, there are things that pelvic floor physical therapists can do to help strengthen the muscles in the pelvic region. And that's usually the first strategy, is to try to seek help from a pelvic floor physical therapist. The differential diagnosis, though, is broad. So some people with urinary issues may have mast cell problems that are causing the urinary issues. There's a diagnosis called interstitial cystitis that's related to mast cells, and that's something that should be considered if people are having a lot of symptoms that feel like they're urinary tract infections, burning on urination and frequent urination. Often what happens with the interstitial cystitis is that it seems like a urinary tract infection, but when they go to get the urine cultured, there's no bacteria in the urine. It's just that inflammation from the mast cells. So that's something to consider. Treatment for mast cells may really help. And the other thing that just to have in mind with frequent urination and urgency of urination, if it's seen in combination with low back pain and a sensation of heaviness in the legs, it can be related to a tethered cord. So that's something else to consider. If the urinary frequency and urgency is combined with a bunch of other neurologic symptoms that suggest the nerves at the bottom of the spine are being compressed.